13 minutes to 7. Let's take a look at this story. Today, marking World Hepatitis Day, a global campaign to raise awareness of viral hepatitis. It's a disease that affects millions of people worldwide. In South Africa alone, an estimated 2.7 million people are living with viral hepatitis, yet many remain undiagnosed until serious liver complications develop. To discuss why early detection is critical and what more can be done to improve access to testing, we are joined now by Merilynn Steenkamp, General Manager for Southern Africa Multi-Country Network at Roche Diagnostics South Africa. A very good morning to you, and thank you so much for speaking to us. So, hepatitis often described as a silent disease. Why does it go undetected for so long, and what are the symptoms?
Good morning. Thank you for having me on the call. Yeah, so such an important milestone for us globally to talk about hepatitis. Hepatitis is generally an inflammation of the liver, which is commonly caused by a viral infection, sometimes excessive alcohol use or the use of toxins. Some people have autoimmune diseases that also lead to this. Now, to your question about why is it the silent killer, it generally goes unnoticed for a very long time and people live really healthy lives until the symptoms become really severe and the liver is really compromised. So it takes a long time for these symptoms to come to surface and people live healthy lives. And then when it comes, it's quite an aggressive disease.
So you've just told us what are the causes, but what are the symptoms so that people be aware of it and they can also seek early testing or testing as soon as is possible? What are the barriers? Why does it remain largely undetected for some?
Okay, so in terms of symptoms, they eventually do appear, and you have a very common symptom like persistent tiredness or fatigue, often nausea and loss of appetite. But I think some of the big indicators are abdominal discomfort, abdominal pain, particularly on the right upper side, dark urine, pale stools, sometimes a bit of jaundice, which is a yellowing of the skin and the eyes, joint pain, and often with fever. These symptoms only appear once the liver has already sustained significant damage, which is why relying on symptoms alone is not an effective way to catch hepatitis early. Testing and preventative strategies are generally the most safest way to prevent hepatitis, and it is preventable, except for those people that may have autoimmune or biological issues. So yeah, vaccination strategies are really, really important. We do have vaccines available for hepatitis, and I think we need to double down on prevention programs and education. I think that's still fundamentally one of the areas that need acceleration in South Africa.
All right, so let's continue along that educational vein, right? So
Sure.
the differences between hepatitis B and C, what are the defining characteristics? Why do they present differently? Because I understand that people can be asymptomatic for years, presenting with either cirrhosis or liver cancer.
This is correct. So, I mean, the issues with the various types of hepatitis, so you have 5 different types. And, you have viral hepatitis, like I explained earlier, and these are caused by specific strains, which is A, B, C, D, and E, which is sometimes spread through contaminated food and water, specifically A and B. And then you also get hepatitis B, C, and D, which is transmitted via blood or bodily fluids. Now, this is really important because it really speaks to the big, consistent issue that we have in South Africa around viral load, around immunocompromised patients. And so hepatitis B, C, and D really needs education in schools around safe sex, around sharing of needles, and excessive alcohol abuse, which is really also part of that spectrum.
And are some of these vaccine preventable?
Yes, some of these are vaccine preventable. In South Africa, we do have hepatitis on the vaccine schedule, but as we progress in this space, there's a lot more vaccines that are being tested and developed to continuously support the spread of hepatitis. And of course, as science evolves, chances are we're going to probably find other variants of hepatitis. So there is a requirement for continuous investment in research, development of vaccines, diagnostic tests to support early detection and prevention of hepatitis.
Okay, so you've mentioned that some are. Can you also just tell us, repeat again, which are vaccine preventable, how we get to that point, and which are curable and which aren't, if that is the case?
So I'm not a medical doctor. I would rather say that your hepatitis, reach out to healthcare professionals. There's a wide spectrum of support around that. So, as babies, we actually should be getting hepatitis shots. So for me, the overall spectrum is around education about childhood vaccination. And I mean, childhood vaccinations in totality requires much more education, but hepatitis specifically is something that can be preventable from childhood.
Okay.
Yeah.
Then let's look at obviously the WHO SDG goals around hepatitis and just to the South African diagnostic infrastructure or public health access with regards to treatment, etc. What is the current situation? What does the data tell us about how far we are from reaching that goal?
That goal. So, I mean, South Africa today, like I said, has a quite robust vaccine schedule. However, the vaccine coverage rates are not where it is. So that's a really important piece for us to double down on as a country. Second to that, we have quite extensive diagnostic testing. And I think that as soon as patients are more educated and aware of symptoms, then drives them to start doing the diagnostic testing. We also need HCPs to understand, also these are healthcare professionals and prescribing doctors, when patients walk in with these kind of symptoms, to be more proactive in doing these diagnostic testing. So we have strong diagnostic capabilities in South Africa. We have established laboratory networks that can support expanded testing. This is both in the public and the private sector. The big opportunity now is to ensure that these resources are fully integrated into the broader screening and prevention strategies, making testing more accessible to the people in South Africa. So I think an area that we need to double down on as South Africa is how do we become more integrated across disease areas and then utilizing the diagnostic tests that are available to us in South Africa.
If you could just tell us a little bit more about what you do at your organization, especially with ensuring that there is a broader population-based screening in high-risk settings. I mean, you spoke about people who are immunocompromised, but let's talk about, and you also spoke about sexual health, particularly what people could or could not do, possibly in terms of prevention. But I am interested in antenatal care, for instance. How do you help in these areas?
Thank you for the question. So at Roche Diagnostics, we are one of the leading diagnostics companies in South Africa and in the world. And we are, bring to the market diagnostic testing for HIV, TB, early infant diagnosis. So we very much play in the space of viral load and HIV. and immunocompromised patients. And with that, we have supporting testing panels that can help diagnose the periphery implications of immunocompromised patients. And as you would know, generally immunocompromised patients, or HIV patients for that matter, generally suffer with peripheral disease impact, and hepatitis is one of those diseases. So that's what we do in South Africa. We have strong partnerships with the government to support awareness campaigns. We're available both in the public and private sector. And so these are the things that diagnostic companies are doing in South Africa, not just Roche. And this is how we support healthcare expansion on diagnostics in South Africa.
Finally, one of the persistent challenges is the cascade of care from diagnosis to long-term care. Are you in any way involved in creating those kind of systems or improving that level of access?
I mean, that's a fabulous question. And I think we have so much more to do as private sector in the healthcare system. So we endeavor to support it through campaigns like I'm doing right now to support it. We do a lot of media, education. We have an expansive program with the Unjani clinics where we try and expand that. But I really believe there's still a lot of work for us to do as society in collaboration with the ministries and the governments to continue educating patients. I think we are very privileged to have a very dynamic young population in South Africa, and the world looks upon us for that. And we have a strong mandate to actually protect that young population. And the work's not done. We continue supporting and networking and collaborating with ministries, NGOs, private sector to expand awareness around various diseases.
And perhaps just one final question, just in terms of dissuading people against stigmatization or how to end it on this World Hepatitis Day.
Yeah, also another fabulous question. Thank you. So, I mean, we've walked an incredible journey if we look at HIV. And I'm really optimistic because of the progress that we've made with HIV. So we know broadly today in South Africa, the number of HIV cases are not increasing, if in fact they are flat or decreasing. And this is because we have partnered well, we have educated well, we have driven the hard agenda of having the right testings and treatments available in South Africa for HIV. And I really believe that hepatitis has that similar trajectory. There is great options out for people in terms of vaccination programs, because that's prevention. Then if you believe that you may be exposed, you have a diagnostic test available. And if you do this early enough, we're sure going to reduce and then eradicate hepatitis, because there are treatment options, there's supportive care. If people don't do anything, we end up with potential death and or sometimes a liver transplant. So these are the end cases. But I'm so optimistic that if we continue driving the agenda of education, screening, and diagnostic testing, we'll definitely break it like we've done HIV.
Merilynn, thank you so much for your time. Much appreciated. To have yourself.
Thank you for having me.
Day ahead. Merilynn Steenkamp, General Manager for Southern Africa Multi-Country Network at Roche Diagnostics South Africa, speaking about World Hepatitis Day. It is 7 o'clock.
The sound of Africa, starting strong.